Hi, my name is Andy Morgenstern. I'm an optometrist from Washington, D.C. I presented a course called The Understanding of the Cornea in Patients with Keratoconus. This topic is really important. A couple of things that we discussed was that keratoconus is a disease that has increased in prevalence over the last couple of years. Our older studies that we had available to us really explained to us that the prevalence of keratoconus was somewhere in the neighborhood of 1 in 2,000. The only problem with that is it was done in about 1986 to 1989, and the tools used at that point were really only a retinoscope and possibly a keratometer. Today, we have techniques and technologies that are much more advanced. They're much more sensitive as well, so we can pick up on this disease at a much earlier point in time and much more consistently. Because of that, there have been studies that have shown that the prevalence right now of keratoconus could be even as low as in the neighborhood of 1 in 375. That is an astounding change to the amount of people that we have to be aware of with this disease. So when we're looking at the technology, it's really important to kind of understand the differences that we use to pick it up. Number one is that we can use devices with the Scheimpflug camera. Most of the time we like to use a device called the Oculus Pentacam, where we can actually look at the posterior surface of the cornea. The posterior surface by far gives us the earliest warning signs of keratoconic disease, and if we could see these early elevation changes, we can diagnose as early as possible. Why is that important? Because as recently as last year, we got a FDA approval on corneal crosslinking for the treatment of keratoconus and post-refractive surgery ectasia. With post-refractive surgery ectasia and keratoconus, the cornea is weakened and it starts to bulge, and corneal crosslinking can actually halt or slow down the progression of this disease. So in summary, one of the things that we have to be aware of is that new technology can enable us to pick up disease at an earlier rate. It's really most important in our pediatric population, because if we can diagnose and identify this disease in a kid, we can actually save their vision for the rest of their life. So please go out and utilize and explore new technology available for keratoconus and crosslinking. And please start to use it in your exam room so we can stop this disease and stop the progression of it as early as possible.